It's a brand new
And we still
day.
have to consider some ideal.
Wake up every morning and say it's a brand new day.
Okay, so a little bit. Look at the camera. So this young gentleman, he has a very round facial shape, as you can see. Can you see? Can you see a round facial shape? Your hands up. Don't work. Don't be shy. Okay. Now, a round facial shape. So a short and a little bit too pointy chin. So what I'm going to do is to give him a support over the mid face to reduce the sagginess and also give him some structure over the lateral face. Then I will do the chin to make it a little bit more projected, square, and elongate. So that's my plan today. Okay. So I will mark the lip cheek junction first. What I'm going to do is I'm going to first close your eyes. Some filling, maybe. Yeah. So I'm going to use a cannula, inject subsmarsely over the cybernetic arch area. So close your eyes. So I will clean the area that I'm going to puncture. See, it's quite deep. I cannot tilt my cannula. It's quite deep, right? Can you see? Okay. Okay. Now I am going to inject retrograde in a linear fraction with the volume.
How many gauge cannula do you use?
I'm using a 25 gauge 30 millimeter for the zygomatic arch and the subzygomatic arch area. You can do a little bit massage. You can do a little bit massage to make the product evenly distributed. It's okay? Okay. Now let's sit up and have a look at the width. So do not inject too hard. Okay? Sometimes you can feel the pulse here. I can feel the pulse here. So don't inject too high. You can see? I do a red marking here. Here is the superficial temporal artery coming out. Okay. Yeah, that's it. Okay, let's proceed for the jaw angle. Now, relax. No, it's sensitive. Now, so I will palpate for the jaw angle here and the jawline, the inferior border of the mandible and the posterior border of the mandible. For him, I don't want to make a very sharp one, so I do a fanning to give him some lifting. So here is my JW1, just like the jaw angle. Now remember, I'm palpating for the facial artery. Okay, I can feel the pulse here. So the facial artery will come up, and you can feel the artery make a bite. Now this is the anterior border of maxilla. So the artery is going up like this. But because I'm doing subcutaneous, so it's fine. Okay, because the vessel is quite deep on the bone. Okay. Okay. Now, again, clean the area behind. Do not puncture the marking. Do not puncture the marking. Puncture. Circular movement. I still have 0.5 Volux with me. Sometimes it may bleed here, but it's okay. No bleeding today. So I go to the subcutaneous.
Again, this is the subcutaneous layer, yeah?
Subcutaneous, okay. Now, you see, I can do a movement like this. It's easier for me. This is also a fanning, but sometimes I do a little bit more over the inferior border to make it more sharp. You can see the cannula is quite superficial. Okay? It's okay? Don't move the head again. Just tell me. It's a bit sensitive near the ear.
Sometimes if we put the filler on the subcutaneous layer on this area,
yeah.
When the patient moves the jaw, it will like look like moving. It's like very popular right now in social media. It's
Clean again. Sometimes it bleed, okay? Now, puncture, circular movement. And this is Volux, 1 ml. Okay, a little bit. Okay, now, go to the subcutaneous. Okay, I'm the subcutaneous. And I'm going to inject 0.7. Relax yourself. Hand. Relax. Okay. Okay, head up a little bit. Now, I'm going to inject 0.7 over this area. So I'm going to do fanning, okay? I'm going up, going down, going up, going up, going down. You can use the other hand to fix the skin if the patient have very lax skin. So going up, going down, going up, going down, you will do a fanning, okay? I'm doing anti-grade because anti-grade will help the patient to reduce the pain because the anesthesia inside the product. So we have lidocaine inside the product. Okay, can you see? It's okay to see? Now, I almost finished. Okay. Relax your mouth. Okay. Sometimes when they are very anxious, they will close the mouth. So ask them to relax the mouth because once they close the mouth, the muscle is tense. They will feel even more pain, okay? Now I'm going to the mid part, so it will be a bit sensitive. Relax, okay? Relax. I'll take it slow. Take it slowly, okay? Let the lidocaine to get the effect. Let the lidocaine to get the effect. Take it slowly. Inject anti-grade, bit by bit. Now I'm almost in the middle. You can see? Okay, now I'm in the middle and I'll finish 0.7. You can see 0.7. Now I retract a little bit and then I go down to the chin apex. Maybe it's this sensitive when crossing this area, okay? Now my tip is here.
in what layer is it? Is it deep or
Subcutaneous. Subcutaneous, okay? I'll tell you why subcutaneous later.
Okay.
Then I stay here, don't move. I use the other hand to do the molding when I inject a bolus. Now I'm injecting, I'm holding the product over this area. Keep it steady here. Do a 0.3 bolus. Do a bolus here, okay? Now you become more relaxed. Okay, now pause. Okay? Finish one syringe, okay? So I'm going to do this support the lower lip. If patient have very everted lower lip, this area help with the lower lip and the mouth of the corner as well. Okay? You can sit down. Okay, lie down. Okay? It's okay. Now, the other side. I'll do the same thing. Clean the area. Open the mouth. Clean the area. And pinch the skin. Now sometimes you check for the veins. Sometimes there is a vein over here. If you puncture the veins, you bleed, okay? And I clean again. Puncture needle. Don't close, don't come in front of the camera. Okay, puncture, circular movement. Another syringe of Volux. Use the other hand. Okay, go into this subcutaneous. Okay, it's sensitive here. Okay, subcutaneous again. And you relax enough. Okay, go down, go up. Okay, head up a little. Yeah. Go up, go down, go up.
So when do we choose for lux over volume on the C1 area?
Yes,
Or-
this is a very good question because many of the time, if the patient have a very tight chin, very tight, you cannot even move the chin, I would prefer use volumer because you got to expand the chin first before you can widen up the area. So I'll use volumer first. Or if the skin is very thin skin, I will use volumer. Or some lady, they have a very small chin and you want to expand the chin, you can use volumer, okay? But for men, most of the time, especially his skin is not very tight, I will use Volux most of the time, okay? Okay, 0.3, and retract, go to the chin tip here, and then do a bolus. Ready for the cross. Okay, do a bolus here. This hand don't move, okay? Just move this hand. Do massage and finish. Now, Now I finished the. Actually I don't need this. I can do with the marking. Now I'm going to do a jawline now. I'll ask him to head up a little bit. Okay. You see, here is the mandible. Underneath. Okay. I will mark my. Relax enough. I will mark my border. Now this is the most anterior jawline, and this is the P-jaw area jawline. Can you see? I'll show you later. Okay? I'll show you later when I finish the marking. Okay, now head up. Can you see? Maybe like this. Head up. Can you see the marking? It's underneath. It's underneath the jawline. So if you look from a frontal view, you cannot. If you look from frontal view, you cannot see the marking. But if you head up, you can see the marking. That's the jawline area. Okay, the anterior jawline. So this will help to push the chin forward. Okay, Volux. So again, I will do, now this time I will do a linear injection, just back and forth, okay? How many times I have?
60.
Okay, I can finish the chin. Now, sometimes I clean the marking first because I don't want to contaminate, but this one does not consider to be clean. Now I'm going to clean the area behind. And I'm going to pinch the skin here and do a cleaning again. You see I clean a lot. Puncture needle, puncture, sometimes it bleed, puncture, rotate, and new syringe. Okay. Now, into the subcutaneous. Yes, subcutaneous. Now, I'm going to inject linearly. Relax the mouth. Okay, inject linearly. Okay, give me an alcohol swab. So I don't want this block here. And this block here. Okay. Now, I'm going to linear injections with 0.5. Anteriorly and linearly. He will feel some tension, but not very painful. Here is more sensitive. Here it should be fine. Okay. And then do a linear subcutaneous injection. Use the other hand to mold and guard the product, make it stay in in place. Okay. Now I finished with the pitch out area with 0.5. Can you see 0.5 here?
Yes.
Okay. Now I push further, relax. Push further and do the most anterior part of the jawline. We call this JW5. Relax. Okay. So I will intentionally leave a gap in the middle so that his chin will be square. Okay.
So it's not until the midline yet?
Yeah, not the midline.
Okay.
I will intentionally lift the area over the midline. So make it more square. And later, after I finish this, I may do another 2 injections on the bone. Okay. And I want to show you how to do a proper bone injection. Okay. Is it okay? Relax your mouth, relax your mouth. Okay. Almost finished. Good. Okay. Now, 1 syringe. Okay. Now I can see his chin projected. Okay? Now the other side. Just let me know if you feel pain. Don't worry, okay? It's a good practice to know your sensation when I do injection. Now the other side. Back up. Now I would say even Volux is a very robust product. Its moldability is very good. So at the very beginning of my practice, when I used Volux, I did have some irregularity after the injection, but it's very easy to mold. It's very easy to mold. You just do some molding, then the whole
For the
chin
molding,
becomes.
is there any like specific time we can only do it in the beginning, or is there we can still do for a few days after?
Now the moldability will stay for only about 2 days. So if you want to mold, you better mold it before your patient go home. Before your patient go home. So you cannot let your patient go home and then come back 2 days later for the molding. Okay, pain. Alright, okay, go into the speed. Now sometimes it's tricky, okay? Go into this subcutaneous. Now I have a problem before. When we say subcutaneous, it means subcutaneous, not the skin. When I did this injection before, I did it too superficial, and then I can see all the products. So do it subcutaneously. You will find it's better for the contouring, and the patient will have less foreign body sensation. If you do too superficial over the skin, it will have some very strong foreign body sensation. Now I'm injecting antegrade. Forward, keep going forward, and almost finish the P-jaw area. Now 0.5. Then I push forward to make the chin project. It's okay? Okay. Now I'm here. Not in the middle, but here. Here is still a linear injection. I will still move my cannula a little bit. It's different from a bolus. A bolus is a spear. It's a circular product, okay? When you do linear, it's a cylindrical product. Okay, cross. Another syringe, okay? Now, I finished the chin, the basic chin. Now I'm going to do another 2 injections. Cross, red cross. I clean the marking, clean all the marking. Okay, relax the marking. I'll clean all the marking. Clean all the marking. And what I'm going to do is a bone injection with Volux again. Volux, needle. Now, okay, look at me. Relax the mouth. Now here I got the midline again. what I'm going to do is do 2 injection. One is this C2 again, C2 again, and the other one is C5. C5 is just a vertical line below the oral commissure. So here is the C5, which is the angle over the mandible, which make the man chin wider. Okay, clear? Clear? Okay. Now, just now you saw I did all injection use cannula. Now I'm going to use needle. Okay, needle. This one, this one, needle. Okay. Now, when you do needle, I always do aspiration. Because I encounter many times with a positive aspiration, and that saved my life. It's not always true that if you got a negative aspiration, it's absolutely safe. It's not. But if you got a positive aspiration, it saves your life once, at least once. Okay. Now, what I'm going to do is, I don't puncture the marking, but I clean the puncture area. Yes. Okay. Now this is the thorax. I will prime the needle first. Remove the product. Now relax. Now don't puncture the marking, but puncture the skin and touch the bone. I touch the bone. Don't press. Just touch it. Can you see my needle? Can you see?
Yes, we
Okay,
can
I
see it.
aspirate. 1, 2, 3, 4, 5, 6, 7. No bleed, no blood. Okay, then I inject 0.3 here. Slowly. Okay.
Always on the bone needle.
This is on the bone. This is on the bone. This is on the bone. Get the balls ready. So 0.3, I will have 0.7 left on my hand. So I inject very slowly. You see, I'm keep pressing the product, but very slow. Because if you inject too fast, the product will disperse. Okay. Now 0.7 now. I get my gauze and 0.7. Now it may bleed, okay? It may bleed. So we have to stop a little bit, okay? Now see, a little bit wider. Now, a little bit wider. I'll do the C2 and C5, okay? So let's finish the C5 first. Okay, again. I try to change the needle if necessary, because every time you change the needle, you will have some product waste, okay? But 2 times puncture, I will change the needle, okay? Now C5, pinch the area. So don't puncture the marking, puncture the skin, touch the bone, touch it, not puncture the bone, just touch the bone. And then do aspiration, 1, 2, 3, 4, 5, 6, 7, okay? No blood. Then I slowly inject. You can count 1, 2, 3, inject 0.05, 1, 2, 3, 0.05. It helps you to steady your injection speed. So I will have 0.4 remain in the syringe after my injection. Okay, almost finished. Okay, you can see I inject very slowly. You shouldn't be any pain now. Okay, close. Okay, now 0.4. So the 0.4 I will speed it up into 0.2 and 0.2. Okay, now relax. Hold. Take away this first. Take away this. And use another hand to press it. Now, I want to explain why I inject very slowly. Because if you inject very fast, the product will go away. But if you inject very slowly, the product will start from your tip, will expand, expand, and expand. It will stay there, okay? So like if I inject linearly over the jawline, if I press very fastly, the product will go up or go down. But I use my hand to hold it, so I can do it faster. But if you don't use it, if you don't use this hand, you inject very fast, you go up or down. Go to the neck or go up to the chin, okay? So inject slowly, slowly, slowly. Let the product stay at the place and expand. Don't let it spread to other end, okay? Now, okay, now, 4 minutes I think I can.
So we'll just do the chin, finish the chin
Yeah.
with the seat.
I finished the chin now. So if you allow me to do maybe 5 more minutes, I can finish the other side. Okay? Okay, now put the other side. Same thing.
Okay.
Is okay? Okay. Now, I'll do it quickly. Just relax. Remember, zygomatic arch, lower border. Which arm? Lower border. Upper border. Canada, volume. This is the zygomatic arch. From the zygoma, angulate towards the top of the ear, okay? So I'm do a puncture here to do injection. That's all. Volume. Okay? Now, relax. I have to go to this mask, under this mask. So the puncture will be perpendicular and then my cannula will touch the bone, okay? Now clean the area I want to puncture. And behind, sensitive, okay? And pinch the skin. And puncture perpendicularly this time. Change the needle. Okay. This one is not sharp anymore. Okay? No, the volume now. Next one. Okay? Volume. Okay. Go down. Yes. Okay. Now, I'm still in the subcutaneous. So pinch, a little bit pressure, touch the bone, and get into the submass area. Okay, submass now. So I'll angulate a little bit. Okay? No. I'll go slowly. Sometimes there's some ligament. Okay. Now I'm go backward towards the ear. Okay. Now I'm here. I'm here now. You cannot see my cannula, right? Because it's under this mask.
Okay. So if we still can see the cannula,
It's
it's
too
not deep
superficial,
enough.
okay? Now, you cannot see my cannula. Then I hold the product, then I start to inject slowly. Let the product expand over this area. It's a retrograde linear injection. So inject 0.2 now, and then continue. You use your other hand to do some molding if you need, okay? Another 0.2, and the last one, sometimes I will angulate a little bit, okay? 0.1, okay? Finish, close. 0.5, okay? Plan, okay, backward, the bottom, okay? Now, I proceed to the subzygomatic area, think about it. Okay. Now, here's the anterior margin. Okay. Now, why I draw 4 squares here is to help me to distribute the product. I have 0.5. So I want to do a little bit more over the posterior to give the lateral vector. So I do 0.2, 0.2, and 0.1 this time for hip. Okay. Sometimes I have 0.7. I do 0.25, 0.25, and 0.2. Okay.
Usually we don't feel the lower anterior.
The
Square.
anterior is the side, the masseter. The lower is about the ear loop. Okay.
Okay.
Okay. Now clean the whole area. And pinch, clean again, and puncture, Relax, okay, hang, okay, circular movement. Alright, okay, subcutaneous. Now, get your candle ready and do a fanning injection, okay, subcutaneous. Sometimes really sensitive, okay. Now, I'm doing injections. You see? Now, 0.2 over the lateral upper quadrant and 0.2 over the lateral inferior quadrant, 0.2 and 0.1 over the anterior superior, which is quite long, so I have to adjust the angle. So sometimes I'll do the angle first to make it shorter, then I can do it easier. Okay, fanning. Okay, fanning. So don't just do a linear injection. You have to do a fanning over the whole area. You cover the whole area, okay? Not just the posterior. Okay.
So it's not a linear.
It's not linear. It's not linear. Okay. Even though the marking look like a rectangle, it's not linear. It's fanning. Okay. Okay. The last one. Okay. I'm over time now, but I think
3 minutes.
Within a few minutes. Dry gauze. Usually I use dry gauze to stop the bleeding because the dry gauze helps. Okay. I palpate for the jaw angle. Then I mark the posterior border and the inferior border. Now you can palpate for the bone. Right? So here's the inferior border, here's the posterior border. My aim. And this is the final cleaning before I puncture the skin. Okay, and puncture. Subcutaneous. Okay. Sometimes it's tricky here because the skin is very thin. So I will show you here's subcutaneous. Okay. So do a fanning. I do a little bit linear at the jaw or inferior jawline. Then I go up and then do the fanning. It's okay. Now posterior, cross. Posterior is a bit sensitive. Okay, it's okay. Okay, here is a bit sensitive. So I do it slower then. If you find the patient feel pain, do it slower. Let the lidocaine get to the effect, and then you see I do it slower, they feel a little bit more comfortable. So use another hand to fix the tissues to do the cannulations. Okay, finish, gauze, dry. Okay, now I finish. So how many syringe I inject? Anyone can answer?
So anyone know?
How many syringe I inject for him? The whole face? How many? For him, I cannot feel the product. Sometimes I feel the product, but for him, I cannot feel the product. Okay? And then I will do the massage for the labrum angle as well. Here I feel a little bit.
Time is up.
It's fine. Okay.
Okay, the time is up,
I do
maybe.
this massage. Okay.
I think that makes Dr.
You see, when I finish my injection, it's already quite smooth, right? It's not irregular, right? The skin is quite smooth, right? But I still do massage because you never know if the product under the skin is collected. Okay? So you do a massage and make it more even distributed. Okay? Now we finish.
Okay, maybe we sit the patient so we can see the
Now,
final result.
Let's clean the. Okay. Look up. I'll clean the marking, and then you can look at the camera and then say something. Yeah. Okay. Now. Look at the camera. Okay. Sit a little bit here. Like this. down here. Look at the camera. Okay, now, can you see the difference? Now, first of all, does it look like being injected? No, right? Not quite lateral, not being injected. But you can see the contour, the whole contour change, okay? Before the injection, he looked tired. He looked very inconfident because of the small chin. He's not very inconfident. But now, he looked more confident. The eyes is bigger. Why the eye is bigger? Because I injected cybernetic arch. The eye became bigger. Then I contour his lower face. The chin is longer, a little bit square. So if I look at the profile view here, okay, look at the profile view. It's not very clear now. If I look at the profile view, I can see his chin projected. So even the double chin area is tighter. Okay. Do you have a mirror? Can you give him a mirror? No mirror? Do you have a mirror?
Yeah, so
No, I'll give you a mirror. You can speak in Indonesia.
so what do you think?
You can take it. What do you think?
So now,
What can you see? What's the difference?
a little more contour for my anatomic radio.
Okay, now let's do some motions. Let's smile. Smile. Show the teeth.
Okay.
Now, you can see. Look at the camera and smile. You can see. Smile. He can still move, but not like this. Okay, this is not a good smile, but he can smile without showing too much lower teeth. Make a kiss. There's no wrinkles when he do a kiss, and then do this. Okay, more. Okay, there's less movement. Now you may say this is light, okay, but I will tell you, even after a few months, he will still have this relaxation because I said I will explain because I inject subcutaneously. That will modulate the muscle. That will a little bit relax the muscle over the chin. That's why he have a better smile, better kiss, and better baby cry. So that's the mild modulation. So that's why I inject subcutaneously. And then afterward, I can do on the bone. If you inject on the bone first, the muscle will activate stronger. And very often I see people inject midline, and then their chin become this,
Yeah.
go up because the muscle. But if you inject subcutaneously, relax, okay? And if you can see, his jawline is very smooth now. His jawline very smooth now, this side. Okay? So this is my demonstration today.
Okay, thank
Alright.
you so much, Dr. Nelson, for
Any-
the great presentation and
Any
data.
questions?
I think
Injection above the muscle, like what I did in the subcutaneous, it relaxed the muscle. And the magic is, even though you don't touch the lip, if you do a lateral vector, first of all, you reduce the sagginess of the face, the oral commissure will lift. And if you do the chin at the second step, you improve the labial mental angle, you reduce the depressor muscle, your whole lips it will go up, even the oral commissure.
It's a brand new day.